Let's talk about the drug treatment for sideroblastic anemia. Yeah, the drug treatment for sideroblastic anemia is just like a one sentence stuff. But I'll just take this opportunity to still refresh your mind on what sideroblastic anemia is. Okay, so we'll go from the overview of the condition, then we'll look at the drug treatment. Okay, so what is our focus? To talk about the drug treatment for sideroblastic anemia. All right, so before we talk about that, we'll actually do a small overview. So sideroblastic anemia, you can see the breakdown of the word. Sidero means what? Iron. That's why you have conditions like siderosis. Blastic means what? Immature. Anemia means what? Decrease in the number of what? Healthy red blood cells. That means there's a decreased amount of what? Healthy red blood cells due to what? Immature formation of what? Immature red blood cells, and this is due to what? A problem related to iron. Okay, so let's look at it. The sideroblastic anemias are characterized by what? Decreased hemoglobin synthesis and intracellular accumulation of what? Iron in erythroid precursor cells. So there's decreased hemoglobin synthesis and there's decreased accumulation of iron in erythroid precursor cells. Do you understand? So now watch this next point now. We said that in these sideroblastic anemias, iron is available quite alright, but it is not incorporated into hemoglobin in a normal manner. Do you understand? So the second point now, sideroblastic anemias are often caused by agents that antagonize or deplete pyridoxal phosphate. Okay, so iron is available, but iron is not going into hemoglobin, right? And this is a problem. So you could say, now we see that sideroblastic anemias are sometimes seen in alcoholics. They are also seen in patients undergoing what? Antituberculin therapy with isoniazid and pyrazinamide. And you can also see them in certain inflammatory conditions or malignant disorders. Okay, so hereditary what? Sideroblastic anemia is actually what? An X-linked. Anyway, you see hereditary, you know that is due to some genetic problems and is what? Sex-linked. Okay, and is inherited. Okay, so now sideroblastic anemia is treated with what? Pyridoxine, that's vitamin B6. Okay, so you want to actually administer vitamin B6. I see that one function of vitamin B6 is what? It helps to make red blood cells. Okay, so the function should be, it is helping the hemoglobin, it's helping the iron get into the hemoglobin in the right way. Okay, so you use pyridoxine, that's vitamin B6, and you can administer it what? Orally, which is the preferred route for this. Okay, but if the patient is unconscious, maybe has some problems with absorption, then you might want to use the parenteral route. This is what? Administering through the intravenous, using the veins. Okay, so now pyridoxine has what? Variable efficacy with inherited forms of the disease. Okay, so now inherited forms of the disease, this problem is from your genes, so you might actually need to um, tighten up management and all that. All right, so this is what a picture showing bottles showing having um, a supplement for vitamin B6. All right, which you can take it like a drug. Okay, the treatment of sideroblastic anemia may also include removal of toxic agents too. So now administration of what? Pyridoxine, thiamine and folic acid, transfusion, that's along with what? Antidotes if iron overload develops from what? Transfusion. Okay, so from the vitamin B6 you can also administer thiamine and folic acid. Folic acid should be vitamin B9. Okay, that's it about what? Drug treatment for sideroblastic anemia. See you guys pretty soon.